the choices of fillers that I would suggest. Well, I'm using 4 types generally for the lip. The Stylish Special Lips, which is a French brand. The Stylish L, which is larger and heavier for people who want bulkier lips. The Restylane is also very good, and an original Swedish brand. And the Juvederm, of course, is also an established brand. In your case, because you don't need a lot of enhancement, actually you need just minimal things. So I would suggest that you use the Special Lip because it's the softest and the most natural in your case. Otherwise, if we really did need a lot, we would have used one of the other brands.
Okay, great. Thanks so much.
So when we do a filling for a young lady, the main concern is to get a natural look and not to overdo it and to be safe. So what the main concern is the artery that's passing on the inside border. So what happens is that we go along the outside border, which is a very safe area, and then we can go longitudinally like that, because this is a safe way you inject. You cannot cannulate the artery if you go like that. So we respect safety and start. We will look for the channel running down there. So when we start closer to the midline, it's easier to find it. You might be able to see the filler running along the border of the lip. Do you feel anything?
No.
Great. Of course, without the local block, this would have been uncomfortable. As you see, we got into the channel and the filler reached up till here. Okay, we don't want to overdo the corners now. Again, the filler flowed nicely up to the corner of the lip. So now the upper lip is done. If we want to do additional filling for further volume, we would go like this. Because perpendicular to the artery, you don't cannulate it and it is very safe. Now we're going to do the lower lip. It's going to be 2 injections on either side and 1 injection in the middle. So let's start. This is our first injection. We are not at the border, but we're close to it to avoid the main blood vessels. It's more uncomfortable than the lower lip because we didn't block it here. We are relying on the anesthetic cream. This is 1 and 2. And of course, when we're done, we can do any adjustments if we need to, but usually, since we're injecting equal volumes, it's enough. Okay. You're okay?
Mm-hmm.
1 and 2. And then 1 in the middle. And we are done.